thrombus, LV apical clot, cardiomyopathy, types of cardiomyopathy, myxoma, also myxoma. Okay. Then any ideas about procedure?
Procedure will take Luelloc syringe.
Luelloc syringe.
And contrast of 1
Okay. 10 ml of normal syringe. Okay.
We will be agitating.
Will get agitated. See, if you all know about agitator, get mixed with one another. Okay, a small 9.5 ml of normal saline infused with 0.5 ml of air will get agitated more and more. It creates a micro nano bubbles. Will help us to filling of air. Okay, which will help us to magnify or will able to know about is there any aneurysm or vein or myxoma or LV apical clot, that and all. Okay. Okay, then agitator.
Then we will be seeing the assessment of how ILD is functioning, Thomas presence from right to left shunts, direction of shunts.
Congenital heart disease, shunt.
There are 2 types of contrast echo, one is agitated triglyceride and using contrast agents.
Okay.
And in contrast agents, 1 to 10 meter diameter will be taken contrast agents. Example, luminity, sonawave.
Okay, sonawave. So here in India we are using only normal saline. Okay, we are the contrast agent are not preferred because of sometimes a pregnant woman also suggested for contrast echo. So if it is we given the radiopac agents will affect the babies and also for mother. So for that complication or risk factors we avoid the contrast agents like sonawave or luminity water. Okay, now we are using normal saline. So normal saline infused with 0.5 ml of air. Okay, then once if you get agitator, we have to check initially normal thoracic echo window. Okay, if there is presence of any shunts, initially we have to find presence of any shunts are there or aneurysmal LV interventricular septum or LV regional wall motion abnormality or LV aneurysmal or myxoma or whatever cancer patients. If it has any risk factors, we have to first assess through the thoracic echo, then we have to come contrast echo. Initially, we have to find. In contrast echo, it is helpful to see if there is any tiny hole or problem at the back of your heart. It is usually carried out in a people who have suffered as a stroke at young age, and the reason why the stroke happened was found from the routine test. Okay, the salt water has been shaken between the 2 syringe or agitator in order to create tiny bubbles. And sometimes coagulation of iota along with VST also there. So for that complicated, we prefer the normal saline. So then agitated saline taken, then what we do? Any idea?
Through echo, we will be seeing the presence of shunts.
Okay.
The microbubbles, how many microbubbles and shunt will be
okay. So agitated bubble get infused through the patients within second or within a minute. Okay, slowly we get infused means once bubbles get passed through the right atrium through the vein which is passed through the superior vena cava and inferior vena cava will reach the right atrium. Is that the bubbles are moved to where? Lungs. If it has no presence of shunt, it is directly moved to the lung and there alveoli get absorbed initially. Absorption completed now, a small amount of bubbles will reach us to the left atrium through superior, 4 pulmonary veins. Okay, so there is no presence of shunt. If it is presence of shunt with right to left shunt means once again infused bubbles suddenly same cardiac cycle will move toward the left heart. Okay, and also left to right shunt means same will happening again. After observing the small bubbles